Okay, so you've just had your upper blepharoplasty done with us here at Visage, so I'm going to go over those post-op care instructions with you. We're going to give you a small care kit to take home, so in there you're going to have ice packs and Aquaphor, and I'll go over how to use these in the video. So after your procedure, you're going to have non-dissolvable sutures on your upper eyelids, and these are going to stay in for 7 days, and they'll come out at your 7-day follow-up with us here. For the first 24 to 36 hours after your procedure, this is generally when your swelling is going to peak. So with those ice packs in your care kit, you're going to wrap them in a cloth or some sort of barrier and just be icing the area for 15 minutes on, 30 minutes off to help mitigate the swelling. To also help with swelling, you can sleep with your head elevated at a 30 to 45 degree angle, and doing this for the first 5 to 7 days after your procedure will help with the swelling as well. Leaving the incision line for the first 48 hours. After 48 hours is when you can start cleansing the suture line with a mild non-scented soap and water, and then you're going to thinly apply the Aquaphor twice a day, morning and night, with a Q-tip. After 24 hours, you can shower. Just make sure that it's lukewarm, that there's no steam, and it's not overly hot, as this is also going to increase your swelling. With your suture lines, we ask that you stay out of the bathtub, saunas, and no swimming, soaking the area for the first 4 weeks after your procedure, as we want to make sure that that incision line has fully closed and fully healed before it's being submerged underwater. For pain, Tylenol and Tylenol Extra Strength are great options. We just ask that you avoid any non-steroidal anti-inflammatory drugs like Advil and naproxen for the first 5 to 7 days after your procedure, as these are going to increase your bruising and possible bleeding. Things to look out for would be signs of infection, so any abnormal swelling, redness around that incision site, any pus drainage, foul-smelling odor, as well as if you have any fevers, chills, and general unwellness. We ask that you please let us know of these right away. During our regular hours, you can contact the front desk. And anything in the evenings and on the weekends, one of our providers here would have given you their contact information for after hours. So if you do have any concerns, please make sure that you are reaching out to them. If you happen to go to the emergency for any reason non-related to your procedure with us within the first 14 days after your visit here, we do ask that whenever you get a chance, you just give us a call to let us know so that we can be up to date on your medical health. Otherwise, that's pretty much it. Thank you so much for choosing us for your procedure, and happy healing.